Hi, everyone. I'm Tyler Nelson. I'm a PhD student in bioengineering at Georgia Tech. And I've actually made the recent conversion from mechanical engineering because I saw an opportunity with my research to impact patients' lives, and I hope you see that here. Lymphedema will affect 1 in 5 cancer survivors. We just don't know who that's going to be. Luminostics has the solution for this. By equipping patients with our wearable technology, we can diagnose lymphedema early when the treatments for the disease are most effective. So a few weeks back, I was talking to a breast cancer survivor named Anne. In the past year, Anne had beaten cancer, and she went to her doctor because she noticed that her arm had started to swell. Her doctor took a look at it and basically said, I don't know what's wrong with you, and she went about her way. Sure enough, it got worse and worse. It eventually became painful and debilitating. And finally found a specialist who was able to diagnose her with a disease called lymphedema, but unfortunately informed her that because it had gone on for so long untreated, that she would have the disease for the rest of her life. And so Anne's lymphedema was caused by cancer therapies. These therapies, like surgery and radiation, damage the lymphatic system in such a way that they can't transport fluid out of the limb. And what you're seeing as a symptom of the disease is that fluid stagnation. So the treatments for lymphedema are effective, but the caveat to that is that they're only effective early on. So using a specialized massage therapy or a compression garment, patients can effectively keep the limb size in check. And there's even evidence to show that the disease can be reversed if treatments are done early enough. So, in fact, the American Cancer Society recommends that all cancer survivors be screened for lymphedema. The problem with this is there's not great tools. So, the gold standard methodology for tracking and monitoring lymphedema is actually a tape measure. And we've talked to clinicians who say this is an extremely inaccurate, variable methodology, and most of all, time-consuming. And then there's other more sophisticated methods, like bioimpedance, that measure the fluid accumulation from lymphedema. But the core commonality between all of these is that they have to be used clinically. And as a result, they're not being done frequently enough, and therefore, patients are not getting that early diagnosis that they need. Luminostics will solve this problem. So the current diagnostic process for lymphedema looks like this. Cancer patients are first treated for their cancer, at which point later on down the road, they'll get noticeable swelling of the arms or legs. Hopefully, they then find a specialist who will diagnose them with the disease and get them the necessary treatments that they need. So the incidence of lymphedema is actually occurring all the way up at cancer therapy. But we're not diagnosing the disease until it's too late, until the swelling is visible. So where Luminostics will act is immediately after cancer treatments. We want to give patients our device that will diagnose the disease early. This opens up a market opportunity of 900,000 cancer survivors every year. These are people that have just beaten breast cancer, prostate cancer, and melanoma. And it's unacceptable that they do not have diagnostic options. Additionally, a lymphedema monitoring tool provides a lot of value to the 10 million lymphedema sufferers in the US that have to deal with the disease every day and would use a lymphedema monitoring tool in the same way that diabetics monitor their blood glucose and tune their therapies for that. So the core value that we provide is early detection to enable effective treatments of lymphedema. And this core value is distributed to 3 core stakeholder groups: patients, providers, and payers. So patients want increased quality of life. They obviously want to avoid an extremely debilitating disease. The clinicians, the providers, want to increase access to patients. They want more patients, and they want the procedures that they do to be quicker and reimbursed more frequently. The payers, which are primarily insurance companies, want to save on the cost of lymphedema treatments. And by detecting and treating lymphedema early, we can cut costs from $11,000 per patient per year to $2,000. Now, Prashant's going to tell you about how we intend to deliver that value to patients.
Hi, my name is Prashant Irudayaraj. I have a background in product development, and I'm passionate about projects that impact people's lives in a positive way. I've worked for Alcoa developing renewable energy systems, and most recently for Tesla, helping them accelerate the transition to electric vehicles. So our solution incorporates a wearable device, an analytics platform, and an app. The wearable device incorporates bioimpedance and a circumference measurement capability. These metrics are sent to our analytics platform, which generates a risk metric for each patient. Bioimpedance and circumference measurements are the current gold standards for diagnosing lymphedema. Now, we want to change Anne's story. Let's roll the clock back to when Anne completes her cancer treatment. Her oncologist sits her down and says, "Congratulations, Anne, you've beat cancer. But you are at risk for lymphedema, and we recommend you buy Luminostics wearable device." Anne complies because she trusts her doctor. He's been with her through the most trying times of her life. She buys the device, pays a subscription fee, and goes on with the rest of her life. On 10/30/2015, our analytics platform detects that she is at risk for lymphedema. Immediately, she is notified, and she is given options for healthcare treatment nearby. In addition, her doctor has a list of high-risk patients, and her name goes to the top of the list. We have a roadmap to get this solution into the hands of patients as quickly as possible. We are currently in development using the Jawbone, and we're using their up version with the bioimpedance sensor to get the data and develop our algorithms. By the end of 2017, we hope to have our own bioimpedance and circumference measuring wearable. We then will file for Class 1 clearance, which will allow us to market the device as a scientific instrument to measure bioimpedance and circumference. This is an important solution for existing lymphedema patients and therapists who can use it to monitor the progression of their disease. We can then use data from these patients to improve our algorithms and enter Class 2 trials. Once we get clearance for these, we can market the device as a lymphedema diagnostic tool. This will allow us to target the 900,000 new cancer patients every year. It would also allow doctors to be reimbursed for diagnosing using our product, using existing CPT codes. Our business model is simple. We have a $200 device, same price as any other Fitbit or wearable, and a $100 subscription fee. Now, we can talk more about this in Q&A, but we're trying to balance value to the customer and profitability. So we hope to enter the market by first evangelizing key opinion leaders, which we have already begun. Dr. Paula Stewart is excited about our solution. We also have great relationships with lymphedema institutions who will be our first channels to our customers. We have great regional relationships, so we hope to grow in the Southeast and then spread to the rest of the country. Depending on how this competition goes, we may start in Louisville. We want to primarily target clinicians because patients trust them. Then they can then go and buy the device. Patients themselves can go and buy the device online through our website. But this is not the only channel. In phase 1, we also want to look at garment manufacturers that create the sleeves because they already have access to lymphedema patients, and so we can use them as a distribution and sales channel. In phase 2, we want to look at big players or EMR systems that have a significant customer base. We're already in talks with Systems Merge, which does EMR technologies for hospitals. They aggregate technologies from multiple providers like Siemens, et cetera. Now, we expect to be cash flow positive in 2019. We have a two-pronged strategy to meet our shortfall until then. We're going after grants and competition winnings to help develop our product and reduce the risk for the investor. But we're also looking for seed money and Series A money to augment our shortfall. So we expect in year 5 to have a $20 million cash flow, with 43% going to subscriptions and 57% going to device sales. Our market opportunity is $1.5 billion, given our current business model and revenue, and the patient base we talked about earlier. Kaylee will now talk about protection.
Thanks, Prashant. My name is Kaylee Richardson. I'm a student at Emory University School of Law with a background in pharmaceuticals and public health. Most recently, I've worked with Teva Pharmaceuticals, as well as the FDA, the CDC, and the American Cancer Society. My legal interests are patents and food and drug law, which is why I'm really, really excited about this project, because it so perfectly combines both of these issues. A key component to our competitive advantage is our intellectual property, and the overall goal is to get as broad protection as possible. Luminostics is in a unique position because at this point, all the technology you've heard about today is ours and ours alone. Nothing needs to be licensed. This means that we don't have to deal with the headache of working with the Office of Technology Transfer, which saves us time and licensing royalties. It also gives us more geographic flexibility. So our first step is to file a patent on the method of using circumferential measurement in combination with bioimpedance measurement to track swelling. It is important to note that the goal is not to limit the patent to tracking swelling caused by lymphedema. We already know that there are very many other important uses for tracking swelling, for example, in heart failure as well as in wound care. Additionally, the algorithm behind the device will be kept internally as a trade secret because that is really the best form of protection for this crucial piece of intellectual property. Over the past 2 years, we have developed close relationships with both lymphedema clinicians and patients, as well as local and national patient advocacy and research organizations. These relationships have played a crucial role in the development of our device and will continue to be important in bringing it to market. We have an advisory board with a great diversity of experience, everything from biotech-based entrepreneurship to intellectual property law, to lymphedema research. And they have been and will continue to be a source of a great, great wealth of knowledge. At the beginning, the three of us will play integral roles in the company. As we've already heard, Prashant has extensive experience in product development and engineering, and he's going to serve as our CEO. Tyler Nelson has many years of experience working in one of the top lymphedema research labs in the country. He'll be our CTO. And we think that our preliminary legal issues are going to be FDA regulations, which is my background, and I will serve as our general counsel. However, going forward, we want to attract a fractional CEO and CTO. We're really looking for people with extensive experience in bringing medical devices to the market. In summary, over 900,000 people per year in the US alone are at risk of developing lymphedema. But the current diagnosis doesn't happen until after the swelling is already visible. This means that usually the condition has progressed to the point where it's irreversible, meaning patients end up with debilitating disorders that they are stuck with for the rest of their lives. Our device is the only solution that not only gives patients a sense of control over their condition, which they so desperately want, but it is the only device that allows early diagnosis, which means that patients can get into the clinics sooner, they can get the treatments they need faster, which means that the condition can be treated before it progresses, so it is reversible. We are Luminostics, and we are shedding light on lymphedema.
So thank you for shedding light on a disease state that I have never heard of before.
Yeah.
But I have two sets of questions I want to start this discussion with, both of which begin with two letters. So the first one is about IP, and the second one is about BS. Let me start with a balance sheet.
Okay.
Let me start with IP. What is your IP?
So the IP is the method of using the bioimpedance data and the measurement and the circumferential measurements in combination. So the IP is not the device itself.
Okay,
it is the method of using these two variables to validate each other.
So does ImpediMed have any impedance IP already?
That is a really good question. Yes, they do. They do have.
Okay, so how do you know that you're not in any way infringing on their bioimpedance IP?
So we have done an extensive freedom to operate search in collaboration with Ed Cleary, who's our legal advisor. They do have patent on bioimpedance, but our technology is going to be, the actual how the measurements are taken are very different. Plus, we are also adding the the circumferential measurements together. So we are very confident.
Okay,
that-
so you're adding the measurement of the tape measure.
That's right.
So there's this thing in patent law, which I'm sure you understand as a lawyer, it's called obviousness.
Yes.
How do you know that adding the tape measure to bioimpedance isn't obvious? And what prevents ImpediMed from doing exactly what you're doing?
Great question. So the whole reason we're going after a method patent instead of a device patent is that exact problem, is that adding two things together is obvious. So the device itself is likely has no patentability, but it's the method of using those two completely different variables to spit out a number that's a lymphedema indicator number.
So how are you going to keep ImpediMed from stepping into the sort of, from the practitioner to the patient, how are you going to prevent them from doing that?
Filing this patent as soon as possible and
how
trying
much-
to beating them to it.
So let me go to BS. How much funds are you raising, and what are you setting aside for your litigation defense?
We hope to raise at least 250,000.
Put your balance sheet up there.
Sure.
By year. No, that ain't the balance sheet.
The-
Where's your balance sheet?
We don't have a
We
full
have it,
balance sheet.
Oh,
Yeah, we just
okay.
have that cash flow.
So let me assume, well, actually, if I look at this, it says that you're not raising any meaningful capital beyond Coulter Foundation money and Georgia Research Alliance money until 2018.
Sure.
All right, so what are you going to do when you're in trials and ImpediMed is out there doing exactly what you're doing with the 200,000 that you've raised by 2018, according to the information you gave us? How are you going to go after them?
So I think we will definitely be in trouble if that's the case. But I just want to emphasize that our competitive advantage is not just the IP. We have the relationships and the ability to get into the market.
Doesn't ImpediMed have relationships?
They do. But we've been doing the customer discovery for 2 years as well, and so it's going to be a competition. We may not get the total market share, but we'll get some of it, and then we can iterate on customer service and other aspects.
If I were you, I'd be looking for that 1.5 million just for litigation defense in 2016. Let me hand it off to.
I'm looking at your phases to commercialization. Your phase one is Jawbone, right? And it is, you're going to market that to therapeutics market, people with, who, like what, 10 million people who already have lymphedema? Is that right?
Yes. So let me make a quick correction, if you don't mind.
Sure.
We initially were thinking of working with Jawbone for phase one, but as we worked with the API and the company, it's been incredibly difficult, and so we are accelerating our development of our own device and entering it in phase one. So we want to enter phase one with our own device that has the circumference measurement and bioimpedance together.
Okay, because that's where my question is why would somebody spend $200 to just do the in existing therapeutics market, because you're not doing any prevention. These people already have it.
Right.
Right.
Okay, so what does your new timeline look like?
Our timeline, this is our new timeline. So we do want to have our device or file for FDA clearance by the end of 2017. So our device should be complete by then and validated.
So the Jawbone is a data collection tool.
Right.
We're using that to validate some of our ideas
Sure.
and
Right.
so Prashant can develop the algorithm. That is not something that we're going to be marketing at all, but it's a data collection tool at this point.
It's like our minimum viable product right now that we're using. It's not gonna, the customers won't, like our legitimate customers are not gonna see the Jawbone.
Right, so you said you've been in the data collection for 2 years now?
No,
Is
so-
that what you're,
2 years ago, we started off with a injectable and we pivoted to this device in late 2015.
so you are doing some market research with Jawbone right now?
Yes.
How many patients?
We're putting it on ourselves.
We're putting it
Just
on ourselves
yourselves.
right now, exactly.
Okay.
And balloons.
And who?
Balloons.
Okay, so so your IP is around the method of combining the impedance with the circumference. Now, what about the other, like you have a cloud-based application that will transmit, that will collect the data and then alert some sort of predictive stuff?
Yes, so we have so our analytics will be in the cloud. So every wearable right now, the power required to transmit to the cellular network is incredible, and you can't have that in a wearable. So every wearable right now transmits you via Bluetooth to the smartphone, and then the smartphone handles the rest, right? We're going to follow that exact same strategy.
And you expect your customers to pay a subscription fee, monthly subscription fee of what, $8 or
$100 a
something?
year.
$100 a year,
$8.30 a month.
which is not,
That's not
Fitbit and
much.
others don't do that though, right? It's
Yes, the subscription fee is for the intelligence to diagnose or provide that indicator that there is a risk, and then also to connect them with their clinician.
Fitbit does have a subscription for like the premium version as well too, and we're priced under that. But we think that we provide more value because we are a medical device. So actually patients would probably be willing to pay more than what we're showing here. This is very conservative.
Yeah, from the patients we've talked to, and we've talked to many, there's really nothing else out there. All the solutions that there are for diagnosis, you have to go into the doctor's office. Patients don't really feel like they have any options, so this is nothing. This money is nothing.
So in keeping with our methodology here, my question probably breaks down into 3 or 4 sub-questions. I think we were going to do one question each and then come back around, but mine kind of fans out into a few
Go to
different
3 for
areas.
1,
So
that's okay.
It's a
We'll
really big question. And of course, I would never offer feedback in a session like this, but for any entrepreneurs listening, you should always have all complete financials if you're ever going to step foot in front of an investor. That is just a requirement in my opinion. My questions, plural, one question, multi-part, center around the cash flow that you put into your business plan. And I saw a $20 million with an EBIT of 11.2 million. That seems awfully rich for a device like this that already has the sensory, the jawbone basically. Is that something you feel like is money in the bank, that level of cash flow?
No.
No?
I mean, there's definitely a risk.
That's
Obviously.
the right answer.
Yeah. No, I mean, we're working on this right now, and our financials are changing. So the more information we get, the closer we get to something that's maybe more representative.
It just seems like with the IoT movement, quantified self, right? It's going to be a commoditized thing to be able to sense this type of stuff on your own body. And so I would question that. I would dig into that probably quite a bit from an investment perspective. Only other question is looking out into your 2018-19, you had profitability starting to happen. Products are going to be very different in a couple of years, especially in wearables. I'm an investor in a company called Recovery Force that does active compression wear. And in their product plan, right, is this idea of biofeedback that can happen from what's going on with your body. Have you contemplated or considered at all the idea that your device that detects could then work with active compression wear to intermittently compress to move blood around the body?
So we have been looking at garment manufacturers that do compression, a form of compression wear for lymphedema, current lymphedema patients. And we have been thinking about integrating our device into some of their garments. We would like to talk to you about your company.
That's really
And see,
interesting.
we're open to partnerships. We're looking to partner with whoever wants to partner with us and get this out there.
Well, I'm definitely going to mention you to them.
Yes.
It's Recovery Force.
Okay.
Recovery Force USA if you want to check them out, and I'm happy to make an intro.
Yeah, please.
Actually, Jobst is extremely excited about a technology like this because it puts more patients in their garments. So they want this right now.
Absolutely.
And
So I'm going to ask my single multi-part question. Okay, first, Tyler, you alluded to, but I didn't see in your business plan, the idea that you could provide value to existing people who are suffering from this disease. To me, that's a big, big point. Can you drill into that?
Absolutely. So just to preface, a lot has changed in the business plan since we've been iterating over the last 2 weeks especially. The problem that we see with lymphedema is not a lot is known about it. So what we're doing is a phased approach. We want to gather data initially with current lymphedema patients. We want to track how lymphedema progresses, because from a research standpoint, we don't know any of that. We have no clue. So by getting that, we can better refine our algorithms, and then we can put it on patients that are at risk for lymphedema. And then that way, if we compare the two patient groups and say, oh, they're progressing in a similar way, well, that group that's at risk will probably get
It would strike me that if you can manage to help the people who have it now, you add a 0 to everything. And that would be something you really should pursue. Secondly, this is treating a side effect of existing radiation, chemotherapy, and surgery. And we saw a previous presentation today of somebody who's working on immunotherapy. So do you guys have the numbers on whether this is slowing down? I mean, what happens? Because my understanding is that does not have the same kind of side effect.
So rates are actually kind of stagnating. They haven't lowered and they haven't increased in probably the last 10 years.
Okay.
So people are still, breast cancer especially, they're getting lymphedema at rates of 1 in 3 women. So there's still this huge survivorship issue that's really being unmet.
Okay, lastly for you, what's the advantage of replacing the jawbone, right? So the jawbone gets you into the market quickly. Can they do what your device is going to do? And if so, why would you do it?
Well, they can do what they can do some of what our device is going to do, but they're not a medical device. And we think that one of the hurdles for them will be they've kind of been skirting the medical device issue and trying to stay out of that because of all the implications of that. And we think that's going to be a barrier to entry for them. The main reason we're avoiding the jawbone is because it's been really difficult to work with them.
Okay.
And
well, that's the
also
reason.
we need the,
So back to his comment about the quantified self, I don't want to wear 5 bands of people's stuff on my body. I want to wear 1. And that's something for you guys to struggle with, I'm sure, because you need the measurements that you need. But if there's a way to get those measurements and not be in the hardware business, you're much better off.
certainly.
We are open to that, yeah.
Okay.
So I'm also going to pull a Bob and ask a long question. Okay. So question 1, it relates to the numbers right up there. So in your plan, you state worldwide there are over 140 million people living daily with pain, depression, infections, debilitation, and $11,000 in yearly expenses caused by lymphedema. While that number is pretty much lower than 140 million.
Yep.
So why the discrepancy?
This is US only, and only lymphedema caused by cancer, okay? So the worldwide leading cause of lymphedema is actually from a parasite. You've heard of it, elephantiasis, big swollen limbs. Same thing. So a parasite is really the leading cause worldwide. That extra.
Okay.
Oh,
Okay, so I get that. So now help me with 2 other things. How many devices would I need to wear? Because if it's a parasite, it could get me on any one of my limbs.
Right.
So am I going to have to wear 4 of these, or how does that
Well,
work?
I mean, we are kind of negating that by only targeting cancer for our initial stages at least, but we hope to get some funding from the Gates Foundation because they're very interested in lymphatic filariasis research. And yeah, you're absolutely right, but in those patients, we know that it only affects the legs. So 2 devices.
Got it.
2 out of 4.
Here's something pretty fundamental.
Yeah.
So you say if you catch it really early, this can lead to effective reversible treatment.
Yeah.
And not if you catch it a little later.
Yeah.
So trying to catch it early could also lead to false positives. Talk to me about that.
False positives are definitely an issue from a liability standpoint. But that's why we have the therapists and clinicians involved in this process. It's not a completely automated thing. So they get the notification that they're at high risk for lymphedema. They go in, they have therapist access, they can send their data to them. And basically the therapist, the onus is on them to make the actual diagnosis. So they'll do that by palpating, they'll take better watch of that patient.
And we're going to have to cut it off.
Yep.
Thank you.
Thank you.
Thank you.